everybody. Welcome to Melanated Health. Today we have an amazing person to talk to, Dr. Amber Brown. She's a doctor of physical therapy and the owner of Root Physical Therapy and Wellness in Plano, Texas. How are you doing today?
Great. How about yourself?
Doing fantastic.
Good.
Thank you so much for taking the time out to talk to us a little bit about what you do.
Yeah, no problem.
So this week is Black Maternal Health Week, and we're just talking to different people in different birthing community fields. And so why is Black Maternal Health Week so important to you?
I think it's just good to share the knowledge. The more that we know, we're able to just bring awareness to like the concerns and how we can have great qualities of lives, and it helps empower us. The more you know, you're empowered, which just makes you be a healthy mama, right? And enjoy pregnancy, enjoy motherhood. So, yes.
Yes. So can you tell me a little bit about what a doctor of physical therapy does?
Yes. So most people don't know, right? They think of us as just after surgery, which isn't the case. We help with anyone from head to toe, anything you could possibly think of, from headaches to your jaw pain, back, feet. We do all of that, but we also have specialties. So some people focus on geriatrics, pediatrics, sorry. That's not my specialty, though I love working with the mamas. The kiddos are different, specialty.
They are.
But they're lovely. They're lovely, I promise. We have aquatics, oncology, sports, dancers, like anything you could think of. Oh, even canine. So anything you could think of, we're there. But my specialty is women's health / pelvic floor, because I treat men as well, oncology and lymphedema. That's my specialty. So, and we like really focus on individualized treatment. So it's never like a one size fits all, which is really nice.
Yes. So you mentioned pelvic floor. Can we talk a little bit more about that?
Yeah. So with the pelvic floor therapy, there's so many different ways that you can become certified or specialize in this. I personally went through a residency program, and then I became board certified. So I sat for a test and have extra initials behind my name. Basically, they're saying, you know what you're doing. So not everyone has that, but that doesn't mean that they're not great therapists, but that's just the training I went through. And so with that, we focus on anything when it comes to, at least if we think about maternity health. We work with preconception or infertility concerns, pregnancy, postpartum. And when it comes to postpartum, anytime you have a baby, you're postpartum. Anytime you have conceived, right? So some people may think, oh, I had a baby 40 years ago. Doesn't matter. Come on in. That's us. We treat. So don't let time, be a limitation with it.
Oh, that is really good to know. So why would someone typically come in to see you after pregnancy or during?
Well, it might be from breast concerns. So during breastfeeding, if there's clogged ducts, sometimes there's mastitis. With me being a lymphedema therapist, that helps as well, where I'm able to actually help with clearing the ducts, showing them how to do it themselves, because of course, most time whenever there's clogged ducts, they don't just clear one time. They may come back. So I want to make sure that they know how to treat themselves for that. If not, come in, I'll help out with it. We also work with C-sections. So if there's if mama had to have C-section for the first or second or third, and they want VBAC, we're able to help with scar tissue during that, or even helping with the birth plan, which when it comes to birth plan, it's nice to know as far as if you have any difficulties, like maybe you had degenerative disc disease in your low back, or you had a previous tailbone fracture or different things. We're able to help out with that, help you with your labor and delivery positions, that you're prepared whenever you go into whichever environment you're going to for birthing and you feel comfortable. So that's definitely part of what we treat. But it can even come down to you're on the floor with your child and you have a hard time standing back up. What mom doesn't want to play with their kid? I've had several moms like, I just want to jump on the trampoline again. Well, come on in. We can help with that.
Good.
But the main things that people think of us for pelvic floor physical therapists would be pee, poo, and pain. And so when it comes to pee, that's really just any kind of bladder dysfunction you may think of. Prolapse, which just means heaviness, like the bladder kind of has shifted and more into the vaginal canal. That can contribute to incomplete urinary or bladder emptying, increased frequency, or incontinence. Most of us know about the leakage, the incontinence. But when it comes to frequency, you really should be going about 5 to 7 times a day. If you're going more often than that, come see me. So that averages about every 2 to 5 hours during your waking hours. If you are younger than 65, you should get up no more than 1 time a night to go to the bathroom. Granted, I know sometimes you're getting up to breastfeed, but it's one thing if you're like, I'm up, let me just try. That's not the same. If your bladder wakes you up at night to go to the bathroom more than 1 time, come see me for that. When it comes to poo, we think about, no one wants to talk about it, but fecal incontinence. It happens. Yeah, no one wants to talk about it, but it does happen. And it's taboo, but I'm here for it. Gas loss. No one, like we all know, we all probably have a friend who you're just like, wow, every time. But sometimes it's a sphincter issue. Come on in. Those are muscles. But then as well as constipation. Change in diet that often happens, or stress. Like so many things can contribute to constipation or even scarring. And what's considered normal is 3 times a day up to 3 times a week, which obviously is a large range. So you should know your baseline. And finally, pain. That means so much. So it could be your tailbone. When you're trying to sit down, you're always having like that sharp pain. It could be your sacroiliac. A lot of people will say sciatica, but it's really most of the time your sacroiliac joint. So if you're trying to lift up your leg one at a time, getting in and out of the car, going upstairs or coming back down them, and normally if you have like a sharp pain or even rolling over in bed, those sometimes are telltale signs. It might be your sacroiliac joint. There's help for that. That's not just postpartum. A lot of times during pregnancy, because hormones are elevated.
Yes.
And oftentimes muscles don't always know how to support you. And if you had an injury, you could have, had an injury playing sports in high school. And then now you're pregnant at like 35 years old. That injury was never really rehabbed. And oftentimes we find that those injuries come back up during pregnancy because of the hormone changes. Mm-hmm. So you should be able to roll over in bed and feel comfortable. And oftentimes we have to work on positioning for sleep. The major thing that people don't talk about when it comes to pain is painful intercourse, or really insertion. The medical term is dyspareunia. That's just saying painful insertion. So it could be from the tampon, it could be from a speculum exam, which are never fun, but we can tolerate them, but at least we need to be able to tolerate them, especially if you have a family history of gynecological cancers, which I'll talk about in a little bit. And then finally, just return to intimacy postpartum. If you had maybe a tear with a vaginal delivery, scar tissue's there. And just like anywhere else in our body, we have some scars that are really smooth. We almost forgot that we, fell and skinned our knee when we were younger, versus you may have family members who have keloids. Same exact thing sometimes, but it's just how the tissue heals. And so sometimes that thickening can happen in the vaginal tissue, which of course is not comfortable if there's friction during intercourse. So that's when people will come in for that. So those are the main things.
Very good. That is something that I do hear a lot that not every woman talks about, but it's just seen sort of as a rite of passage. As you get older, whenever you laugh, you cough, you sneeze, you might leak a little bit, and all those things.
Yes.
It's just kind of thought of as normal. So are you saying that that's not what's supposed to happen as we get older?
Oh, no. It's common. It's common that it happens, but it's not normal. So some people will blame it on genetics, like, oh, it happened to my mom or happened to my grandma. It's going to happen to me. Not exactly. Those are muscles. So if we stop and think about, if you had knee replacement surgery, we all know you need physical therapy. You need to strengthen up the muscles to support yourself. Pregnancy is beautiful, but traumatic to the body. And sometimes the body needs help healing. And with that, you need to just have the muscles relearn what to do. In other countries, it's common that once you are pregnant, physical therapy is part of your treatment plan. So right off the bat, you're already getting treated. I forgot to also mention, people know about diastasis, rectus, abdominis, fancy medical term for like the mommy tummy or the gap in the middle. When some moms are like, I can never get rid of the bulge. You can get rid of it. But again, the muscles have to relearn how to come back and what we call approximate to decrease that distance. Every mom will have a DRA. Every mom. That's the only way baby can expand and the uterus grows. Is the main concern is postpartum, if everything's able to come back together. But we're able to help treatment with that. But yeah, a lot of things are common, but don't accept it as normal, as your new normal. Don't do that. There's help.
So when would you advise someone to come in and talk to you?
Yeah, so it could be, again, mentioned preconception, if they've tried other techniques and they're just like, something's just not, I can't quite get there, but they have maybe a history of endometriosis or other just gynecological or abdominal, like several years or multiple abdominal surgeries, scar tissue, which affects how well the organs are able to move. So whether you're having difficulty getting pregnant, if you're pregnant but no pain, still come in, get your baseline. That's when we can definitely go over birth plan if need be with you. We can teach you how to engage your muscles, but also we could teach you exercises to do immediately postpartum. Get that blood flow going to the muscles so your tissues heal quicker. But also pregnancy, if you're having pain, come in. For postpartum, I normally will have people still come in for a screen. If you're at your 6 weeks mark and you're like, I think I'm good, still come in, because a lot of people will be surprised with even just the weakness possibly of their pelvic floor muscles. And what I mean by that is, if I ask you to shrug your shoulder and you're kind of like, I could kind of get here, that's weakness versus here. That's kind of what the pelvic floor does, where if immediately postpartum, you're kind of like right here, and then you go 10 years worth of not doing anything to strengthen that muscle, naturally it's going to become weak. The muscles they're at the bottom, like they are your hammock. Their job is like to hold everything up. Your bladder, your uterus, your rectum, they're holding things in place. And so over the years, if you have weakness and then they just become weaker and weaker because you don't know how to get them stronger, that's when we start saying, oh, I feel heaviness in my pelvic floor. I'm not sure what's happening. Some moms have to go get hysterectomies. But one part of it is because over time, the muscles weaken and weaken, the uterus drops down even further and then is uncomfortable. And so all these things contribute to, well, if we had started strengthening those muscles, you would have had more support. So if you're thinking about becoming pregnant, come in. If you think about it, or even if you are, or if you already had your child, come in. Get a screen.
Yes. And you also mentioned the VBAC. And so just in case anybody wasn't aware, a VBAC stands for a vaginal birth after a cesarean. Can you talk a little bit more about that?
Yeah. Scar tissue again, right? So I don't know if anyone realizes how many layers have to, like, of tissue are cut through in order to get to the uterus so baby's able to come out and be born. Several layers. And even the direction of the incisions change. So going back to earlier when I mentioned some people heal smoothly, some people keloid, all those layers sometimes bind together. And they're supposed to be able to move easily Like we don't feel it every day. We don't feel it, but your tissue should be able to kind of just glide, like the back of your hand, how it just moves. That's
Mhm.
really how the different layers of your tissue should, if they're functioning properly, that's how they should move. But when they lose that efficiency and they kind of get really stiff, that's whenever different organs aren't able to be as efficient. So some people will lose nerve, like they don't have as much of a sensation after their surgery.
Yeah.
I have a lot of moms as we try to really work on their core engagement, because our deepest abdominal muscle is what we call our transverse abdominis. It's your internal back brace. We think about it during pregnancy because we have to learn how to stabilize again, but it's supposed to turn on and off. And a lot of times, especially after cesarean delivery, if there were nerves cut, which is not unusual, there are a lot of nerves in abdominal muscles or in the abdominal area. Sometimes it's difficult for those muscles to be able to engage again. And so we have to go through that training, like, hey, get the scar tissue moving, help get your sensation back, help get your motor skills back, the motor control. That way you don't keep having that pain. So VBAC, well, really, cesarean delivery is a huge surgery. So, you know, and if you stop and think about it, cesarean delivery isn't like any other body part when you think of surgery, because most time we're told to rest and recover and heal. But you're a mommy, depending on, are you bottle feeding? Are you breastfeeding? Is this your only child? Do you have a toddler? You don't ever really, most times, just get to rest and let your abdominal muscles heal all the way. So, so being able to know how to move and protect is key. And then also, when it comes to VBAC, whenever you officially have your tissues moving better again, that makes it just more comfortable. Because I know some moms say as the pregnancy progresses, they feel like a tearing. Some do, not all. A tearing, but what they're feeling, the uncomfortable is tearing of scar tissue because the uterus is pushing against old scars.
Mhm.
So, I'm like, I'd rather you not feel that. Come on in.
Oh, no, definitely not.
Not all, I should say, disclaimer, not all moms feel that. So again, think about the difference between a smooth scar versus like a keloid. Not to that extreme, but you just know the difference in how people heal.
Very nice. You've brought up so many great and interesting things. I know hopefully women are listening. Is like, okay, so what do I need to do to keep this from happening? How do I
Yeah.
get in touch with you? Where do I go from here? And all this stuff. So
Yes,
how
yes.
can somebody get in touch with you?
Yes. So on Instagram, I'm Rootptwell, and then on Facebook, Root Physical Therapy and Wellness. You can email me at info@rootptandwellness.org or call and text 469-717-0329. I suggest everyone reach out. Like, it is, we are self-quarantined, so I have time, but still reach out. We can get a schedule, because if I can help you just because I'm in Plano, I know other resources who may be nearby. So this is not just for Texas folks. This is for anyone listening. And then also, you never know if there's treatment unless you ask. So don't suffer in silence. If it's not me, I could get you to an OB or midwife, whoever you need, but ask. Don't suffer in silence. Be empowered.
Yes, I love it. All right. Thank you so much for talking to us today, Dr. Amber. And
Yeah, thanks for having
all of
me.
our information will be posted below the video. So make sure you get in contact, ask those great questions. All right. Bye, guys.
Bye.